Perfect. Okay, guys, welcome to our channel. Do you ever watch YouTube videos and that's what everybody says? Welcome to my channel.
Subscribe.
Awesome. So we just kind of wrapped up what did we do? We did a series on different ways of eating. We did a series on your cycle and cycle syncing. We're about to start today a series on birth control. And I think we've even talked about circling back around and hitting some more of the diet things that people have been sending in like requests of like, hey, let's talk about this. Let's talk about that. So that's what's on our radar if you've been following along with our hormone chats each week. And let's just do our quick introduction. My name's Dr. Heather Rhodes, holistic pharmacist, here to support you in simplifying your hormones. And we have Leisha.
I'm Leisha Drews, functional diagnostic nutrition practitioner and registered nurse turned holistic hormone coach.
I love that we both came from like health industry, like traditional health world. Like you were a nurse, I was a pharmacist. We went through everything they teach you in the westernized medicine world of how the body works and how to fix it with medications, really, in different interventions. And then we both were like, yeah, I think there's something more. And went that holistic route. And now we get to see patients actually heal and come off of meds. And we each shared a little bit of our story. I think yours was mainly driven by like your family not wanting them to be dependent on meds. Your little girl with her asthma. It was your daughter, right?
Yeah.
And then I feel like mine's been driven by my own story, but also like recognizing being in the world of westernized medicine that like people want to get better and feel better. And so I think that that's a really good segue into what we're going to talk about now, because I want to make sure that as we go into what is birth control, what does it do, why does it matter, all of those things, that everyone hears our hearts in that we are not saying if you're on birth control, you need to just go get off of it right now. We're not saying that it's a bad option. It's just everyone can kind of sit on this spectrum with where they're at and what their body needs right now. And I think there's a huge disservice because a lot of people are just given birth control and don't necessarily want to take it. Just feel like they have to fix different ailments or even to prevent pregnancy. And I also think that some people want to come off of birth control and then they try and then their symptoms get worse. And there's very much a physiological reason for that. But then they're just given more birth control, or their birth control is causing side effects like spotting or headaches. And they're just given more birth control on top of it. You know, I have a lot of clients with IUDs and then they have side effects and their doctors are like, well, here, take the pill too. And so we just want to shed light on like, why is all that happening? What's the function behind all of this? But definitely hear us in that we're going to be very blunt with what birth control does and how it works in your body. But if it is serving a purpose for you right now in this season, let it and take and absorb information. And we're actually even going to do an episode on transitioning off of it if that's what you decide eventually, and making sure you have the tools and are kind of equipped to do that if you want to. So just kind of hear us in that. That's my little disclaimer before we start. But
that none of this is medical advice, as we are not your practitioners. And specifically, I am not licensed as a pharmacist or doctor. So I will never tell you to get off of medication, even if you are my client. But with that being said, like, I had the experience, and I speak to so many women who have had the experience of being put on birth control as the only option. And so we want you to be well equipped to make an informed decision for yourself. And so if you hear what we talk about with birth control, how it works, and next week we're going to be talking about things that we wish that we knew before we took birth control, because we've both taken it, and really like how it affects your body in so many ways. We just want you to know that information because we didn't know it. And because so many women did not know it, whether that's for you or whether that's for your friend or your daughter. We just want women to be well equipped and empowered in their own healthcare. And that's why we're here, not to tell you to take a medication or to not take a medication. And we are going to be honest, and we are going to give you our true stance on it, because that's what we're here for. We're not here for watered down truth.
100%. I love it. So let's go ahead and dive into what even is birth control. So there's definitely a couple different options. So sometimes I think people, maybe, I don't know, maybe this is more widespread news right now, but if you're utilizing an IUD or oral hormones, oral contraceptives, the Implanon, which goes in your arm, like these are all forms of synthetic hormones termed birth control. I've just had people have IUDs before and not realize that like when we talk about birth control, we're talking about your IUD too. There's one IUD that does not have a synthetic hormone in it that is used for birth control purposes. It's the copper IUD. And so when we talk about birth control, we're mainly meaning those interventions that contain those synthetic hormones. So the copper IUD would not be included in that. However, the copper IUD brings its own bag of worms. Maybe we'll talk about that too. But it works in more of a structural component. So birth control itself mainly is working because you are giving your body synthetic hormones in a format. I'm trying to think the best way to describe that. In a format where it is actually turning down your natural hormone system. So it's kind of telling your body like, hey, you're getting these hormones every day. You don't need to make them anymore. A lot of people find it really interesting when we talk about the fact that like taking birth control actually makes your body think it's pregnant. So that's why it doesn't release another egg and ovulate. And people are like, wait, what do you mean? And it's like, well, yeah, I mean, that's how it works. And then I did just want to kind of throw in here, this is different than a conversation around HRT. So HRT is hormone replacement therapy, used more so in like the later transitional phases to perimenopause and menopause. So just hear us that there's some nuances and some differences there when you talk about HRT versus birth control. But okay, what did we say? So essentially birth control is where you are taking a hormone every single day. Your body thinks like, okay, we're getting this hormone every day. We don't need to make any more of it. We're going to shut down that system. Whereas the copper IUD works in a structural way, meaning that it creates a really hostile environment inside of the uterus so the implantation can't occur. Am I missing anything there we want to add about just kind of like the most basic way of how it's working?
Yeah, I think that when we were talking about cycle syncing last week or the last couple of weeks, and we talk about those like shifts in hormones that happen throughout your cycle, just to be clear, we're saying when you take birth control, you're basically now some birth controls, again, like this is kind of the weeds, so I'm not going to go super far into it, but some birth controls are just the synthetic form of progesterone, which is progestin, and some have estrogen and progestin. And I think most have both, right?
Yeah. So most, if you are not postpartum, then you would need to have that estrogen in there. So most of them do have both in there.
Right. And so you have a little bit of both of those hormones and just keeps your hormones at a low level for the whole month, basically, and triggers your brain not to make those bigger spikes that would cause you to ovulate. Basically, that's the first mechanism of action, is that it is supposed to keep your body from ovulating. Yeah. Now, of course, we all hear the stories that some people still do ovulate on birth control. I think that's generally most likely with not consistent use is when we usually see that, but it can happen even with consistent use in certain people. And so the second mechanism of action of those two hormones is if there is a failure of you not ovulating, then it can thicken your cervical mucus, which makes it a little bit harder for sperm to get through to potentially fertilize that egg that you potentially ovulated. And then the third mechanism of action of those hormones is that it makes your uterine lining less likely to implant. And so with the copper IUD and with that third like backup form of like, not form, but third backup method of preventing pregnancy, both of those are the things that make people who are very staunchly pro-life feel that birth control could be abortive. And so with that being said, I know that that's like a whole other topic, but I do think that a lot of women do care about that. And I think it's worth noting that that last mechanism of action where you could potentially have a fertilized egg that cannot implant would be the method that would make birth control potentially abortive. And so that's just something to be aware of. Yeah. But there are actually like 3 different things that birth control does to help prevent pregnancy.
Yeah, no, I think that's good because I've even had people talk about, that aspect of things. And I had to even be educated myself in the beginning on like, well, why would they think that that's what's happening? But I'm glad that you clarified that. Yeah. Another piece that I was thinking about there. So again, remembering too, sometimes we may think that so the biggest fad right now is like, well, I'm on a low dose birth control. I shouldn't say biggest fad, but like, I think I'm hearing a lot is like, well, I'm on a low dose birth control. It shouldn't be impacting things that much. Or can't my cycle still be regular if I'm on a low dose? Or maybe I shouldn't be having these symptoms because I'm on a low dose. Here's the thing. If we think about your natural hormone balancing system, think of it like a machine, right? So you have this machine that works in your body all of the time to keep your hormones balanced. We know, as we've discussed in the last couple of weeks, certain things can throw the machine off. And so it's like, oh, I've got to self-correct. I've got to self-correct. I've got to self-correct. And that's how hormone imbalances happen in general. Birth control, if it is there, if you are taking it, if it is going in your body, if it is implanted in your body, it turns the whole machine off. So I don't care if it is a micro dose of birth control, your body's natural mechanisms to keep your hormones balanced are off. They are totally turned off. So you can be doing all of the things in the world to balance your hormones. And if you are taking birth control, the machine is off. So we can't, I think that's a really good thing to just remember when it comes to perspective, because a lot of times we can think it's us, like, I'm just not strict enough with my diet, or I'm just eating something, or I've got food sensitivities or whatever, because we're doing all of the things and we're not noticing a change in our cycle or in our hormonal symptoms or our PMS. And I think the important thing to remember there is like, hey, you're not going to see it until you turn that machine back on. So that brings us to what we're going to talk about in a different session, about like how you can still support your body even while you're on birth control. And then the other thing that I did want to mention is that a lot of times we do see ovulation occur more frequently with the IUD. And so the IUD is releasing those synthetic hormones in like a localized area with the intent. So the IUD works a little more strongly with that first mechanism of, I'm sorry, not the first one, the last mechanism of action of making the environment in the uterus kind of like not a great place. So it's decreasing your body's ability to build up the uterine lining and to have great blood flow there. And that causes some of the side effects we see with IUDs. But we do see that there's a higher, I think it's like 25% of women on an IUD will still ovulate. And so that's something to remember too. And then also thinking about when we were talking last week about cycle syncing, and, you know, if you're even looking at like, well, how should I eat during my cycle? You may feel like you're still having a cycle because you're still having a period, but if you're not ovulating, you aren't having a cycle. What's happening is when you either take the placebo pills or you get to, you know, a specific, let me back up for a second. Because I think what's important to know is that your body has these hormones released from other places. They're just in really, really low amounts. So you're not cycling, but your body's still making hormones. So just, is that too confusing, you think? I hope not. Okay. So your body is still making, so like your breast tissue will still release some estrogen and some progesterone. So that's how people can have, you know, the IUD, that's how some people can still have cycles or periods every now and then, because maybe they're ovulating or maybe those levels are just dropping. And so I think going back to our week one, what we talked about, having a decrease in progesterone is what causes your uterus to contract. So as soon as you stop taking the pill that has the active ingredients and you start taking your sugar pills, those synthetic progesterones drop, they signal to your body, to your brain, contract the uterus. And so that's why essentially you still might feel like you're cycling, because every 21 or 28 days or every, 4 months, if you're on one of the different types of birth control, you are releasing that lining. And that is important because they have done some studies to show like, hey, when you actually menstruate and release and shed this lining, your body does a lot of different things that are beneficial. So it can decrease your risk of things like endometrial and cervical cancers. And then it can also help remove things like excess iron, which Leisha's like the genius on that stuff. And it's a way of your body detoxifying. So what do we want to add to that?
Yeah, I was just going to say, when you start talking about having cycles or not having cycles on birth control, I know that it can be popular, especially in like really busy times of life. Like I've heard of women who are like deploying in the military and they're like, well, I'm just going to skip all my placebo pills.
Oh yeah. Yeah.
That is a very extreme situation, understandable. And I would still argue that there's a lot of benefit to having a cycle. And really a natural cycle is going to give you the most benefit, because when you're
Oh, for sure.
taking hormonal birth control, you're not having that natural rise in progesterone that is so good for your thyroid and for your blood pressure and for your blood sugar, like all of the things that we love in health. But with that being said, even if you are taking birth control, skipping the bleeds, I think can exponentially increase your buildup effects of the birth control in your body. And specifically with iron, because birth control does contain iron, and some birth controls contain up to 75 milligrams of iron per dose per day. Your body actually needs 1 milligram of iron per day. So you're storing that iron usually in your tissues. If you're not bleeding, you're not getting rid of it. And so if you are taking birth control all the time and you never stop and you keep taking that iron, you're just exponentially increasing your iron stores, which can exponentially build your oxidative stress and your aging even. And so even if you don't necessarily care about your health, like you do care about aging early. So like both of those
Especially,
things
I
are
think
correlated.
yeah, sorry. I was going to say, especially egg aging. So we talk about, I have a lot of clients that want to get pregnant and they've been on birth control for years, and then they get an AMH drawn and it's like, you have no eggs, or your eggs are so old or look so old, and blood work, all of that type of stuff. And that's something important to remember too, also, that I've had plenty of clients that they come off birth control and they get these labs drawn for fertility reasons. And it feels devastating because it's like, oh my gosh, like I didn't know, and all of this. But remember that the machine has been turned off for years or months. It can get turned back on, and that blood work can look different. So hold on to that if you're someone who's, thinking in that realm. The other thing you said that I think is so important is thinking about the women that are getting birth control with added iron are probably the women that are showing that they're anemic. So their blood is showing, hey, you have low levels of iron. But we know most likely if your blood is showing low levels of iron, it means not that you don't have enough iron in your diet or that you aren't getting enough iron. Usually it means that you have a lot of iron that your cells are holding on to. And so these same women that are looking anemic are now getting more iron. And the reason their cells are holding on to that iron usually is because they're missing what we call the transporter. So if you think of it like a boat, like think of your cells as a little island, and you need a boat to come and take the iron to the next place. If you don't have those boats, the iron's just chilling in your cells and on this, island. And so what happens is we then start adding more iron to them in their birth control, and they're skipping placebo. So they're never getting they're never getting iron removed.
They're never even getting to the island time that they want.
Yeah, exactly. And so I think it's so important that like we're just compounding the issue when we're adding these things. So if you're someone who has crazy periods or irregular cycles or crazy PMS or acne, and maybe you're chronically anemic, if your doctor's coming to you and saying like, okay, perfect, do you need a birth control with added iron? I would say that's a red flag to go get some functional, deeper dive look into what is really going on. Because from, an overarching perspective, Leisha, I'd love to hear your thoughts on this too, but I feel like the only condition that birth control is effective in aiding with is endometriosis. That's the only time that we've seen where birth control can actually have an influence on the pathophysiology of what is happening in the body. Whereas what birth control is used for is acne, no. Heavy periods, no. PCOS, no. Like these are all things that birth control is used as a treatment for, but it's not actually treating, it's band-aiding and kind of like covering everything up. Endometriosis has a tiny bit of a different piece where it can actually help the mechanism a little, but only in the most severe cases, with a very targeted approach where I like to add functional work on top of that. So I just think that's important too, to recognize that birth control is being used and prescribed as an answer for a lot of things for women that it's not necessarily truly solving. It's just turning the whole machine off. It's saying, oh, well, your hormones are driving these problems you're having, so let's just turn the whole thing off. And that's most likely making things worse, which we're going to talk about next episode. But do you have any difference there of opinion on that?
There probably is a lot that we could go into with the specific conditions and why birth control may or may not like cover the symptoms. With endometriosis, I think that there always are underlying causes that need to be addressed. So I would not think that whether birth control helps in the moment or not, for the person, is probably a case by case basis.
Yeah.
And it's not going to fix it long term. So what else can we do is always my question. And I do think that sometimes birth control, other medications, thyroid medications, like there are all different types of medications that sometimes you use as a bridge while you're working on the underlying causes. And I just wanted to say with birth control, so the story that I hear a lot is I was 15, I had terrible periods, I had acne. So my mom put me on birth control, or my dad or whoever put me on birth control because they wanted me to feel better, right? Out of love, like 100% no harm meant. And from that point on, I couldn't get off birth control because every time I did, my periods were terrible. Okay, so my thought there is there was an underlying issue that was causing your periods to be terrible, whether that was iron or estrogen or gut issues or liver issues or thyroid issues or all of those things together, probably. Like there's something there that caused those issues. And when you take birth control, it kind of like puts a little Band-Aid on the symptoms, like we talked about. It keeps those hormone levels low. So you're maybe not seeing the big changes, but it does nothing at all for the underlying liver dysfunction, except for actually makes it worse.
Yeah.
It does nothing for the underlying gut function and the inflammation, except for makes it worse. It doesn't do anything at all for your estrogen imbalance, because your liver and your gut are generally impaired at that point with the birth control. And so you're not detoxifying well. And maybe you are getting some iron, which stores in your tissues with estrogen. And that can also lead to weight gain. The more estrogen you have in your tissues, the more, estrogen is made by fat cells. Sorry, I'm going the wrong direction with that. But estrogen is made by fat cells. And so the more weight you gain, the more estrogen you have, which can actually kind of just keep that process running. So with that being said, birth control, when used as the answer to hormone problems, is not the answer, and likely is going to do more harm long-term. And so with that being said, there are other answers, and we're going to talk more about what those are. But I think it always comes back to what we talk about every single time, which is nourishment. So if your body does not have the nutrients at a deep level that it needs, if you're not getting some of those key nutrients, if you're getting a lot of processed foods versus whole foods, if you're not getting enough protein, if your blood sugar is not balanced, if your stress is crazy out of control, if you're not sleeping, your hormones will never be balanced. You may see the anomaly person who still just like gets pregnant like that, feels great all the time. But for the most part, most women are not that way. And it's not to say you couldn't get pregnant necessarily, but there will be symptoms that come up at some point, usually with that pattern of lots of stress, poor nourishment, poor sleep. And so going back to those basics is always going to move you in the right direction. And sometimes added support and functional labs and all of those type of things are also needed. So I just want to go back to that piece that like, no matter where you are with birth control, there is hope to move forward. Your body was created in an amazing way. It can heal. There are so many underlying factors for a lot of the symptoms that you're facing, but you don't have to keep feeling like that. Even if you choose to get off of birth control and you realize like, okay, there's still some stuff here. There's always help that you can get. And there's always going back to those basic pieces of nourishment will always move you forward. So,
yeah, I think that's so good. Our bodies have a system. It's designed to work well. If something gets disrupted in the system, turning the system off doesn't fix the problem, right? It's super interesting. You mentioned increasing weight. And I say this because I have a friend who is in nursing school right now to be a nurse practitioner. And she sent me a screenshot of her PowerPoint in her lecture yesterday that says, let's debunk myths about oral contraceptives. So birth control. Do not increase weight, do not cause PMS, do not cause infertility, do not increase headaches. And I literally was like, oh my gosh. I was like, check the package insert of any birth control. And on the package insert, which is what they showed in studies, which is how the medication got approved for use, it will say side effects include, and it lists out weight gain, headaches, depression, anxiety, all of it. And so, and I think also when people think about the side effects of birth control and why they don't tolerate it well, there's a couple things, you know, around what exactly you're talking about. Your liver has to be supported, your gut has to be supported, and adding a synthetic hormone that your body has to work through to break down that it's not used to makes that worse. Mm-hmm. And also, when you aren't getting natural progesterone, your body feels crazy and it increases stress, and that doesn't just influence your reproductive system. High stress level influences your thyroid, it influences your skin, it influences autoimmune conditions, allergies, all of it. And so people may think, well, I'm getting progesterone inside of, you know, the IUD or the pill. You're not. You're getting, you're getting a synthetic form of it. So it's kind of like, if I was going to say, like, this is a terrible example, but it's what's coming to my brain. It's like saying that I am taking a piece of cotton and calling it toilet paper. Nope. Cotton can't even turn itself into toilet paper. It's the same thing, right? So like in your body, that synthetic progesterone, it's there. It kind of looks like your real body's natural progesterone, but it doesn't interact at all in the same ways. And it doesn't influence your cortisol and stress system at all. So important things to know. I feel like you really ended it in a great spot. I shouldn't have even added anything on, but taking us back to understanding, hey, your body can do this. This isn't a solution, but you at least need to know what it does. And we're going to talk more next week about some of the things birth control can also influence. I think one last thing I just have to throw out here is like our final little tip. Birth control turns off your libido and it shrinks your sex organs. Do not forget that, because a lot of people are taking birth control to prevent pregnancy, but then it's actually shrinking your ability to enjoy sex, which is why you're taking the birth control, right? And so it's a whole thing. And there's also other ways to prevent pregnancy that are just as effective. We'll talk about those too.
Okay, tell us if you want us to talk about libido, because I think that would be a great, fun topic as well.
Yes. I love doing libido chats. Okay, cool.
Okay.
Questions anyone has, shoot over to either of us. We're always available. You can reach me at Dr. Heather Rhodes on Instagram. Alicia is abundant.life.wellness on Instagram. And I know we've been sending these out to our list, so feel free to email us too. You've got our email addresses if you've got this link. So yay. And I'll add all of that stuff into our show notes as well. Bye, everyone.
Bye.